So let's begin this second portion of the second half of Chapter 11, giving an overview of some of the major antimicrobial drug groups. We have antibiotics, synthetic drugs, which fall under antibiotics or any of the other groups. There are antifungal drugs, antiparasitic drugs, antiviral drugs, and also, not listed here, antihelminthic drugs. That is, drugs that are used against worms. Overall, there's about 260 different antimicrobial drugs, which are classified into 20 major drug families, and we're going to go through a few of those now. The antibacterial antibiotics include the penicillins, cephalosporins, and some other beta-lactam antibiotics. Both penicillins and cephalosporins are beta-lactam drugs. There are the aminoglycosides, tetracycline antibiotics, chloramphenicol, other streptomyces antibiotics, the bacillus antibiotics, and a few new classes. So we will take a look first at the penicillins, which are a large and diverse group of compounds. Now, they can be synthesized in a laboratory, but the fact is it's easier, more economical to obtain natural penicillin through microbial fermentation and modify it to a semi-synthetic forms. The fact is we also just use pure natural forms of penicillin in the form of Pen-G and Pen-V. But anything that has psyllin, ampicillin, doxycyllin, any of those are semi-synthetic forms. They've just been penicillin that is modified. Now, the major source of the penicillins is Penicillium chrysogenum, and penicillins have three major parts. The beta-lactam ring is the big part. These are considered beta-lactam drugs. We also have a thiazolidine ring, and we have variable side chains, which will dictate the microbial activity. Penicillin G and V are the most important natural forms. I prescribed penicillin V almost daily when I was in practice when someone came in with an oral infection. It is an extremely good antibiotic. Penicillin is the drug of choice for gram-positive cocci, streptococci, some gram-negative bacteria like the meningococci and syphilis spirochaete. There are semi-synthetic penicillins, which include ampicillin, carbonicillin, amoxicillin, and these have a broader spectrum. They're actually effective against some gram-negative enteric rods as well as our cocci. Now, there are some organisms that are resistant to penicillin. They produce an enzyme called penicillinase, and they can break down regular forms of penicillin. But we have penicillinase resistant forms of the penicillins, which include methicillin, nafcillin, and cloxacillin. There are several problems that arise in using the penicillins, allergies being a big one. People have been exposed to penicillins for a long time, and the more exposure that you have over your lifetime, the more likely you are to develop an allergic reaction. And once you've developed an allergy, you really can't use that particular drug again. There are also many resistant strains of bacteria. Again, because the penicillins are used a lot, they have pushed the development of microorganisms that can survive against them. The cephalosporins account for the majority of all antibiotics administered now. It used to be the penicillins, but these are isolated from Cephalosporin acremonium. It's a mold, and they also have a beta-lactam ring that can be altered. These are relatively broad spectrum, resistant to most penicillinases, and they do cause fewer allergic reactions. Now, some of them are given orally, as in pill form, liquid form, and many of these must be administered parenterally. Now, when I say parenterally, that means as an injection. There are several families or generations of cephalosporins. So the first generation, these were the ones that were first developed. So cephalothin and cefoxazolin, these are effective against gram-positive cocci, pretty much the same as penicillin. Second generation, cephalocore, cefonacid, more effective against gram-negative. We have the third generation, cephalexin, cefotaxime. These are broad spectrum against enteric bacteria with beta-lactamases, that is, enzymes that can break down that beta-lactam ring. And we have ceftriaxone now, which is a new semi-synthetic broad-spectrum drug, and it is used to treat a wide variety of infections. Another category of drug are the aminoglycosides. These are products of various species of soil actinomycetes, in general streptomyces and Micromonospora. Broad spectrum, again, they inhibit protein synthesis, and they are especially useful against aerobic gram-negative rods and certain gram-positive bacteria. Some of the names you will be familiar with: streptomycin, and it's actually very effective against bubonic plague and tularemia. Both bubonic plague and tularemia are possible bioterrorism agents. This is also used in the treatment of tuberculosis. It's one of 3 drugs that we're going to talk about in relationship to tuberculosis, and you should keep track of what those are. Gentamicin is less toxic than streptomycin. It is used against gram-negative rods. And then there is a newer tobramycin and amikacin, which also work against gram-negative bacteria. There is a problem with gentamicin, which is gentamicin toxicity. This is a common form, actually the most common form, of something called bilateral vestibulopathy. This occurs when balance portions of the inner ears are damaged. The symptoms typically include imbalance and visual symptoms, and the imbalance is worse when it's dark and you can't really see the ground. We get a lot of feedback and cues from visual information, and as long as we have that, we can actually function fairly well. But in the absence of that feedback, we do start to have problems. So in the dark or when footing is uncertain, there are visual symptoms which only occur when the head is moving or when it's moving quickly. Quick movements of the head will cause this sort of transient visual blurring. Your eyes can't track the way they would otherwise. And this can cause difficulties with seeing signs, for instance, while you're driving, or recognizing people's faces while you're walking. Now, in situations like this, these people generally don't drive. In fact, there is a commentator, Keith Olbermann, who suffers from this very condition. He did not have the gentamicin toxicity. He actually had a blow to the head, which resulted in this imbalance, and now he cannot drive. The tetracycline antibiotics. We're familiar with tetracyclines. These are broad spectrum. They block protein synthesis. A couple of newer ones. Tetracycline's been around for a long time. We have doxycycline and minocycline. These are oral drugs which are taken for STDs. They can also be administered for Rocky Mountain spotted fever, Lyme disease, typhus. One of the things that we're very familiar with tetracycline is the treatment of acne and also protozoal infections. Now, tetracyclines are contraindicated for someone who is pregnant. Because they can stain teeth, they are also contraindicated in people that have not fully developed their teeth yet. Basically, anyone under the age of 12, you probably don't want to give a tetracycline antibiotic to. The reason for that is that you can end up with tetracycline staining like this, and you can see that this person has gray teeth. This isn't too bad, but I have seen cases more like this, where it's really deeply ingrained into the teeth. This is very hard to treat. You're not going to be able to bleach that out. Someone who has something like this is probably going to end up having to have veneers applied. Another drug, chloramphenicol, which is isolated from the Streptomyces venezuelae. Potent broad-spectrum drug with kind of a unique nitrobenzene structure. Not going to worry so much about nitrobenzene, but you should know that chloramphenicol blocks peptide bond formation, so it interferes with protein formation. It's not derived from natural sources. We can make this stuff in the lab, but it is very toxic. So there are limited uses, very restricted uses. It can cause irreversible damage to bone marrow, and since bone marrow is where we make red blood cells, where we make all of the formed elements in our blood, all the immune system cells, we really don't want to mess this up. Still, if a person has typhoid fever, brain abscesses, certain rickettsial and chlamydial infections, basically if there is no other treatment that's going to work for them, then this is a drug that can be used. There are other Streptomyces antibiotics, which include erythromycin. And just so you know, this is a macrolide antibiotic, and I would want you to know that it's a macrolide. I don't care that you know, well, macrolide really means large lactone ring. So, but just know macrolide. It is very broad spectrum, has a relatively low toxicity, and it will attach to a ribosome, which will prevent protein formation. It can be taken orally for pneumonia, Legionella, chlamydia, pertussis, diphtheria, and is prophylactic prior to intestinal surgery. It is great for penicillin-resistant diseases. It is also the drug of choice when someone has an allergy to penicillin. So it is great for gonococci, syphilis, acne. There are some newer semi-synthetic macrolides, clarithromycin and azithromycin. Basically, if you see mycin, it is a macrolide. Anyway, the downside with this, it can cause some fairly significant stomach upset, particularly if you take it on an empty stomach. So patients may say, well, I'm allergic to erythromycin. You got to distinguish between an allergy and a side effect. An allergy is something that's going to cause you to itch, break out in a rash, whereas stomach upset, that's unfortunately that's a side effect. Now, other Streptomyces antibiotics include clindamycin, which is broad spectrum. It's good for serious abdominal anaerobic infections, but unfortunately it can cause pseudomembranous colitis. We have vancomycin, which is a narrow spectrum, and generally, actually, a narrow spectrum antibiotic is a better choice if you can make sure that you are getting a drug that will effectively work against the organism. This is effective against penicillin, methicillin-resistant staphylococcal infections. And having said that a narrow spectrum is good, this particular one is not. It is very toxic and it is hard to administer. Now, rifampin, it has a limited spectrum. It cannot pass, not cannot pause, but it cannot pass through many cell membranes. But it is used to treat gram-positive bacteria, TB, and leprosy. Finally, I think we have the bacillus. Oh, I'm sorry, not finally. But we do have the bacillus antibiotics. which include bacitracin, which is a narrow-spectrum peptide produced by the Bacillus subtilis. It's a major ingredient in Neosporin ointment, so you put that on when you have a cut. We have polymyxins, which are narrow-spectrum peptide, fatty acid component. Basically, these can break down the cell membrane. Use is limited because it causes toxicity to the kidney, but it is good against drug-resistant Pseudomonas, drug-resistant Pseudomonas, and good for urinary tract infections. We also have synthetic antibacterials, which include the sulfonamides, or sulfa drugs. These were the first antimicrobic drugs. There's sulfasoxazole, which is good against shigellosis, urinary tract infections, and protozoan infections. There's silver sulfadiazine, which is good for burns and eye infections. In fact, this is put in the eyes of newborns to prevent them from developing infections. Trimethoprim, which is given in combination with the sulfomethoxazole, which is also good for UTIs. And with that, I hear my dog. We have just completed the second part of our the third part of the presentation here. We will pick up on a few minutes.